we still live like in this world where pain is something you need to kill. Even the word in English, painkillers, it's about eliminate. It's
Yeah.
just zero pain is the only pain uh, valid. Like
Acceptable. Yeah.
yeah. I think that's a bad framework. If you want to kill pain and if you want to reduce pain to zero and you don't understand, and that's the goal of your therapy, you're gonna fail. It's not gonna be a successful process. But if you understand that pain is something that your body has in order to tell you that there's a potential threat to your health, it doesn't even mean that it's real. It could be real, but it could also be a potential threat, something that because of your history, because of your sensitivity of the nervous system on many other things, it can uh, it can trigger some nociceptive signals. But it doesn't mean that necessarily there is something wrong with your body and then you need to shut down pain no matter what in the shorter time possible. I think that's one of the biggest issues when people don't have successful pain management
Yeah.
therapies.
And there's just, I mean, it's going to be more and more literature that comes out on that one
Hmm.
regarding the education of what expectations we have. Looking at all these questions that came in, Juan, let's pick one and address it and move on. Any particular jump out at you that you want to make sure we hit the grouping of?
Yeah, I think
There's about 10 of them.
yeah, there's so many of them, but there's a group of questions, a huge one of intervention, of tell me what to do. And what I would say is like, stop chasing that recipe, stop chasing that magic exercise, that magic therapy. It doesn't exist. Like when people ask me, what is the best exercise for low back pain? It's like asking me, what is the best food in the world? I mean, who knows? It's like, it's very individual. So
Spanish
every,
food, of course.
yeah, but it's a stupid question actually, because it depends on the person, it depends on the moment. The same exercise can have a very positive outcome for someone, a very awful negative outcome for other people. So every time you see on the internet or whatever, like exercise to fix back pain, like run away, like swipe and keep scrolling and do whatever you want to do, because I don't think, I think that's something that is going to create more confusion, and you're gonna try to do that with your patients or clients without understanding why you're doing that.
Yeah.
So
I was just going to add to that very phrase because I think this is a super important. I mean, so many people are writing and asking specifically for what exercises, just
yeah.
to understand where Juan and I are coming from on this. And we're very much principle based. So we're individual based. We look at the ICF model and it's like, what do you want to do? What do you believe? What do you believe is causing your pain? All the different variables when we're looking at this. So the prescription that comes out of our intervention could have, 10 people could have the same exact degenerative joint disease diagnosis with completely different exercise selections. We're not going to tell you an exercise sequence, but what I will tell you is we can help you with things like your critical reasoning skills. We can help you with asking the right questions. And, how do you model synthesizing information efficiently to be able to come up with some goals and some direction for your client? And I would always go back and ask, of course, I'm very connected to the principles of movement, but the idea is this a coordination and awareness problem? Because it could just be a behavior problem. They have a behavior problem, they change the behavior, the pain goes away. Is this a load problem? They're not conditioned to be able to handle the load for sitting longer than 10 minutes or standing. Is this a mobility issue? They only move from one place and the strategy is to move from L5S1. So of course
Yeah.
L5S1 hurts. And, we've had so many experiences, and one likewise where, you do one exercise of bridging and maybe some pelvic tilts and some breathing exercises, just teach them to move from one or two more segments in their back. And they're like, wow, I feel 50% better. It's so different for every single person. And there's times where we have people that same exact diagnosis, And we know that there are so many other factors that are, work, relationships, stress, depression, old injuries, old beliefs, old experiences that interfere with where they are. So it's like you could do any exercise and it's not going to make any difference for them.
Yeah, and actually, even though you are an expert and we both deal with this kind of patients on a daily basis, and we research and study and we are up to date with everything that is going on, you don't really know what is going on, what is going to happen, sorry, when you do something. You have a probability of success. Like, I know because of my experience and I have some research and evidence background in order to make this decision and try. But it's basically an iteration. It's a try. Let's see what happens. And this has to be your mindset when you prescribe some exercise and you try to do some exercise. It's not like this exercise is going to fix, and if not, it's problem with the patient or I need more exercise. No, sometimes is again, I always say, is navigating this chaos and this uncertainty, and just to be comfortable in that uncertainty. So
you don't want to just teach them core control exercises?
I don't think so. Sometimes I do, but you need to decide why you're doing that. But one of the in the course that I've made of chronic low back pain, the usual feedback that I receive is that the course is fantastic. It has a huge information. It's clear. I understand now more about chronic pain and all the situation, but there is no exercise to do, and that's a deliberate decision that I made. I cannot go and throw exercise on an online format just to let the people work if we don't know what we are dealing with. Like you said, it's based in principles, it's based in the interview, it's based in the ICF model, in understanding all the variables and all the things that influence in pain. And then is whatever. We have a lot of tools. You don't really know what is going to help. Maybe you have a crazy idea and you try and that works. And that's fine. As soon as you understand, or if you have a path of reasoning to understand, okay, maybe this is because of this, and let's going to continue this way. So there's no exercise that are better or worse, or that you can use at the beginning or at the end. Everything kind of can be a nice or a terrible decision, and you don't know until you try it.
And I know that's hard for people to hear. I mean,
that's it.
That you and I both get critiqued for that a lot of times in our presentations. And yet, if you come watch us, I mean, we're using we're 90%
all the time.
Experience.
All the time.
And a lot of times they're the simplest of exercises. It's just in functional activities. Somebody had asked, what is the ICF model? And that's the International Classification of Function and Disability Model by the World Health Organization. And we use that in Polestar and particularly in physical therapy around the world, and in medicine, to be able to classify somebody's physiological limitations, their functional limitations, their activity limitations, their participation limitations. So in Polestar in particular, we put a huge focus on participation in our assessment. Is, if I was working with Juan, what do you believe you should be able to participate in? And he might say, hey, I need to be cycling 50 miles and I'm going to go hike Mount Kilimanjaro or whatever. And then I have to think or learn or go seek what those activities require in my body or his body. Then I can assess his body and I can see, this is where Juan is. This is where Juan believes he should be. So that we're either writing his belief and bringing it closer into alignment to where his body is, or we're creating a plan to bring his body to where he believes he should be. But the picture starts becoming very clear. And when I say clear, it's like 50% chances that what you're going to propose might have a chance of the next step of outcome. And so that's why we're so hesitant to say, oh, do this sequence, 3 times a week, and wow, you're going to have this miracle outcome. It'll never happen.